We're now going to go to page 15 of the Public Health Services Act, and the reason we're going to do that is because this is where you'll find the original section 2702, which has been modified in the health care bill. This one's saying prohibiting discrimination against individual participants and beneficiaries based on health status. So, in other words, you can't be denied coverage under a new health insurance for any of the following reasons. Your current health status will not determine whether you're eligible for health insurance or not. Your medical condition, and that includes physical and mental illnesses. Your claims experience. If you had bad claims experience with the former insurance, that has nothing to do with what you're going to be doing here. Receipt of health care. No matter how much health care you received in the past, that has nothing to do with your enrollment with new health insurance. Medical history. They can't go through your medical history to determine whether you're eligible for medical insurance or not. Genetic information. They can't demand that you take a genetic test so they can see whether you're eligible for health insurance or not. And this doesn't just apply to being eligible for health insurance. They can't say to you, say, well, okay, you've got a medical condition, so your premiums are going to be higher than the next guy's. Now, they can do that with tobacco use, but if you have heart problems, they can't say, well, your insurance is going to be higher because you have heart problems than Joe Blow over here whose insurance is going to be lower. They can't do that. Alright? And if you have a disability, it doesn't matter. You get to pay the same rate as everybody else. Okay? And that's what the original section 2702 was talking about. They were talking about both. They can't say you can't have this health insurance because you have heart problems. Then they cannot stand there and say because you have heart problems, you have to pay one price, but this guy over here who doesn't have heart problems, he gets to pay a much lower rate. They can't do that. Isn't that nice? But anyway, that's the original section 2702. That's what they're referring to. You can read all this stuff for yourself. Finally, we're done with Healthcare Bill Part number 38. And now we can go back to the original Healthcare Bill and maybe we can go on. Alright, I'll tell you more in a future video, so stay tuned.